Hello, my name is Dr. Yolanda Lewis-Ragland, and I would like to welcome you to Navigating Vaccine Hesitancy in Black People in 2021. The presence of racial disparities in vaccine uptake has been a complex challenge for many years. According to the CDC, as of March 28, 2021, racial disparities existed in the percentage of people with at least one dose of the COVID-19 vaccine and among those who were fully vaccinated. And the Kaiser Family Foundation found disproportionately low COVID-19 vaccine uptake in Black communities with increased burdens of COVID-19 deaths nationally. The objective of our qualitative study is to improve the understanding of how underrepresented minority healthcare professionals who witness and experience contradicting historical, racial, and scientific arguments navigate the complex climate of COVID-19 in America and use their influence and their expertise to combat low COVID-19 vaccine uptake among Black communities. Using the phenomenological framework, 15 underrepresented minority medical professionals in various roles in the healthcare system were interviewed to discuss their observations of low COVID-19 vaccine receptivity in their community, their personal reflections on the national vaccine rollout, and their personal view on self-vaccination. The cohort consisted of authors from an anthology exploring how underrepresented minority healthcare workers confront racism in America, health disparities in medicine, and the trauma of COVID-19. Participants were excluded who were non-clinical or who opted out. Inductive study methods were used to elucidate novel and shared perspectives among interviewees, and common themes were extracted using a qualitative coding consultant. Our study found common experiences revolving around two larger categories with multiple themes. Overall, these healthcare workers experienced shared themes that contributed to vaccine hesitancy in the populations that they serve, but they also found shared strategies that help reduce vaccine hesitancy in their communities as well. Regarding factors that increased vaccine hesitancy, our interviewees found that by 75% that misinformation about the vaccine was detrimental. Then there were 50% of our participants who stated that misinformation about the COVID virus itself, the COVID-19 virus itself, was detrimental. Another 50% found that there were concerns about the rapid production of the vaccine that contributed to hesitancy. 42% cited conspiracy theories that help increase vaccine hesitancy. And then lastly, 33% of interviewees found that there were the past ill treatment of the Black community by the medical community that caused vaccine hesitancy or contributed. Then there was those factors that help reduce vaccine hesitancy. What were they? 67% of us found that face-to-face counseling was helpful. 50% found that providing factual information at the time of the procedure was helpful. Another 50% found that being authentic about your own fears or experience was helpful. And then 42% found that engaging with the local community in discussion was helpful. 33% found that social media was a powerful tool. Another 25% felt that using trusted sources like the NIH and CDC was helpful. And then 25% found that using their authentic platforms to share information was helpful. What are the implications of this study? Well, formal data analysis is still ongoing. Future investigations are encouraged so that we can understand vaccine hesitancy in Black communities going forward.